Hello, everyone, and welcome. I'm excited to have you here today as we explore our topic, comprehensive overview of oxygen therapy. Today's presentation will cover the principles behind oxygen therapy, when it's indicated, the different delivery systems used, and important safety considerations. We'll keep it focused and practical, helping you understand the key aspects of this essential treatment. Let's get started. Let's start by understanding the oxygen present in the air we breathe. Ambient air contains about 21% oxygen, which might seem like a small portion, but it's actually vital for our survival. Now, when we talk about oxygen itself, it's a colorless, odorless, tasteless gas. Despite being invisible and undetectable by smell or taste, it plays a crucial role in keeping us alive and ensuring our bodies function properly. This brings us to the topic of oxygen therapy. The main goal here is to provide supplemental oxygen when needed. Its purpose is to increase the oxygen saturation level in the blood, which helps ensure that all our tissues and organs receive enough oxygen to work efficiently. So, whether it's for someone with a respiratory condition or during certain medical situations, supplemental oxygen therapy is a key tool in supporting overall health and recovery. Let's delve into the main goals of oxygen therapy. First, we have correcting hypoxemia. This means treating or fixing low blood oxygen levels to ensure the tissues and organs receive enough oxygen to function properly. It's crucial because inadequate oxygen can lead to tissue damage and other complications. Next, oxygen therapy aims to reduce the workload of the heart muscle, or myocardium. By improving oxygen supply, we help ease the strain on the heart, which is especially important in patients with cardiac conditions. Finally, one of the key goals is easing respiratory effort. Breathing can become laborious and exhausting in many respiratory conditions. Oxygen therapy helps reduce this effort, decreasing fatigue and making it easier for patients to breathe comfortably. All these points tie back to the overall theme of supporting patients' respiratory and cardiovascular health, ensuring their oxygen levels are maintained at optimal levels while minimizing the strain on their bodies. On slide 4, we're focusing on the signs and symptoms that indicate hypoxemia and the potential neurological impacts of oxygen deficiency. Restlessness, disorientation, impaired judgment, and confusion are some of the early neurological symptoms we might see. As hypoxemia worsens, patients can become very somnolent, lose coordination, or even slip into a coma. These signs are critical because they tell us the brain isn't getting enough oxygen, and prompt action is essential. Now, aside from neurological signs, there are visible physical indicators as well. For example, bluish discoloration of the skin, known as cyanosis, typically appears in severe cases where oxygen levels are critically low. In terms of cardiovascular responses, an elevated heart rate, what we call tachycardia, is a common reaction to hypoxemia. It's the body's way of trying to circulate more oxygen-rich blood. Patients often complain of shortness of breath, or dyspnea, which is a subjective feeling of not being able to breathe comfortably. This is a key symptom that alerts us to respiratory distress. We also observe increased use of accessory respiratory muscles, like the neck and chest muscles, as the body works harder to breathe when oxygen is scarce. Finally, rapid breathing, or tachypnea, is a clinical sign that oxygen levels are low. It's the body's attempt to compensate and bring more oxygen into the lungs. All these signs and symptoms help us identify hypoxemia early on, so we can intervene with appropriate oxygen therapy and prevent further complications. Let's take a closer look at the comprehensive overview of oxygen therapy. First, oxygen therapy is primarily used to maintain adequate oxygenation during the post-anesthesia recovery phase. This is a critical period where patients may be vulnerable to hypoxia, so ensuring they receive enough oxygen helps support their recovery. In cases of severe trauma, oxygen therapy becomes even more essential. These patients often have compromised respiratory function or blood loss, making sufficient oxygen support vital for their stabilization and healing. During a myocardial infarction or heart attack, oxygen therapy plays a supporting role in cardiac oxygenation. Since the heart muscle needs ample oxygen to function properly, providing supplemental oxygen can help reduce the extent of damage. Oxygen therapy is also recommended when there's suspicion of hypoxia based on clinical signs. For example, if a patient shows signs like cyanosis, shortness of breath, or altered mental status, we should consider administering oxygen even before laboratory results confirm hypoxia. Of course, when hypoxia is documented, meaning confirmed through clinical assessment or lab tests, oxygen therapy becomes a clear indication. This ensures we're targeting therapy appropriately and effectively addressing the patient's specific needs. In summary, oxygen therapy is a versatile tool. It supports recovery after anesthesia, helps manage severe trauma cases, assists during myocardial infarctions, and is crucial when hypoxia is suspected or confirmed. Connecting these points underscores how vital oxygen therapy is across various critical situations, ultimately aiming to improve patient outcomes. Let's take a closer look at some of the potential risks associated with oxygen therapy. First, prolonged exposure to high concentrations of oxygen can lead to oxygen toxicity, which can damage lung tissues and other organs. It's important to carefully monitor oxygen levels to prevent this. Next, in patients with chronic respiratory conditions, administering too much oxygen can cause oxygen-induced hypoventilation. This happens because their bodies may reduce their own drive to breathe when they receive high oxygen levels, so we need to be cautious. Moving on, there are specific hazards we should be aware of. For example, in neonates, excessive oxygen can lead to retinopathy of prematurity, which can affect their vision later on. Also, high oxygen concentrations can cause absorption atelectasis, where alveoli collapse because oxygen replaces nitrogen that normally keeps them open. Finally, we can't forget that oxygen supports combustion, making it a significant fire hazard. Ensuring proper safety measures is essential to prevent any accidents. Understanding these risks helps us use oxygen therapy safely and effectively, aligning with our goal of providing optimal patient care while minimizing potential complications. Let's take a closer look at how oxygen therapy can be tailored to meet patient needs. When providing oxygen, we generally fall into two categories: systems that only supply part of the patient's inspiratory flow and those that meet all of it. First, some systems provide only part of what the patient needs during inhalation. This means that the oxygen concentration they deliver can vary depending on how the patient is breathing and the type of equipment used. In other words, the oxygen level isn't always consistent, which can be a concern in certain clinical situations. On the other hand, there are low-flow systems, which are designed to deliver only a portion of the patient's inspiratory flow requirements. These systems are useful for less critical cases and can deliver a pretty stable oxygen concentration, but it may not be precise enough for everyone. Then we have high-flow systems, which are quite different. These systems deliver all of the patient's inspiratory flow needs, ensuring a consistent and accurate oxygen concentration. They are especially beneficial for patients who require more precise oxygen therapy. Understanding these differences helps us choose the right system for each patient, ensuring effective and safe oxygen delivery tailored to their specific breathing patterns and clinical needs. Now, let's take a closer look at some of the low-flow oxygen devices commonly used in clinical practice. First, we have the nasal catheter, which is inserted along the nasal floor. It typically delivers flow rates between 1/4 and 8 liters per minute, providing an FiO2 roughly between 0.22 and 0.45. One thing to keep in mind is that this device requires frequent repositioning to ensure proper oxygen delivery and patient comfort. Next, there's the nasal cannula, which is probably the most familiar device. It delivers oxygen at flow rates from 1 to 6 liters per minute, and humidification is recommended when you're at 4 liters or higher to prevent dryness and irritation. An important point here is that the FiO2 increases by about 4% with each additional liter per minute, so increasing flow rates can help meet higher oxygen demands. Moving on, we have the transtracheal catheter, which is surgically placed between the second and third tracheal rings. It delivers oxygen at lower flow rates, from 1/4 to 4 liters per minute, and unlike some other devices, it doesn't require humidification. However, it does carry risks such as infection and mucus plugging, so careful monitoring is essential. Now, let's discuss the simple mask. This device covers the nose and mouth and typically delivers flow rates between 5 and 12 liters per minute. The FiO2 it provides ranges from approximately 0.35 to 0.5. When flow exceeds 5 liters per minute, it helps prevent CO2 rebreathing, making it suitable for short-term use or emergency situations. Finally, there are rebreather masks, which include a reservoir bag. These can deliver a much higher FiO2, from 0.6 to 0.8 or even higher if fitted tightly, reaching up to 90 to 100% FiO2. But it's important to remember that inadequate flow can lead to suffocation risk, so proper setup and monitoring are crucial. Overall, understanding the different low-flow devices helps us tailor oxygen therapy to each patient's specific needs, balancing oxygen delivery with safety considerations. Now, let's take a closer look at high-flow oxygen devices. One example is the air entrainment nebulizer, which produces aerosolized oxygen with humidification. This is particularly useful when we need to deliver oxygen in a mist form, often through devices like aerosol masks, face tents, track collars, T-pieces, and oxy hoods. These setups help ensure patient comfort and effective oxygen delivery. Next, we have the Venturi mask. This device uses variable jet orifices to accurately deliver a specific fraction of inspired oxygen, or FiO2, ranging from 0.24 up to 0.5. An important point to remember is that Venturi masks are not humidified, so they are best suited for patients who don't need additional moisture. Also, if the entrainment ports become blocked, the FiO2 can become inaccurate, so proper maintenance and monitoring are essential. We also have oxygen blender systems and non-rebreather circuits, which are designed to provide very controlled oxygen delivery in specialized settings. These systems are crucial when we need to ensure precise oxygen levels, especially for critically ill patients. Overall, these high-flow oxygen devices play a vital role in our ability to tailor oxygen therapy to each patient's needs. They contribute to stable and predictable oxygen delivery, which is key in managing varying clinical situations effectively.